Hello, everyone. Welcome, everyone, to our AEFI presentation module today. My name is Pilar Hernandez. I'm Managing Director at the SORMAS Foundation. Today, I will be moderating this webinar today that will be presented by our colleagues, Obina and Chris. Christophe Garot, he is a Senior Project Manager at the SORMAS Foundation. His background is medical, and he has lots and lots of experience in the international context. He will be presenting the rationale behind the development of the AEFI module in SORMAS. And then we will have Obina, who is a software developer currently working at the SORMAS Foundation. He has also lots and lots of experience with SORMAS development. So we'll have a really high-level people here today with us. So I will hand over to Chris for you to start with the presentation with the rationale for the development of the AEFI module, and then after Chris has presented all this introduction, then we'll hand over to Obina for the technical presentation and the demonstration of the module. Again, please, you're all welcome to ask your questions, put them in the chat, send your comments, and then we will take the questions at the end when your microphones will be turned on and your cameras as well, of course. So Chris, over to you. Yeah, thank you very much for being here.
Thank you, Pilar. Thank you for having me. I'm going to share my screen and start the presentation. So we have this new feature, a new module in SORMAS, and I will briefly going through two steps. One is what is an AEFI, and the second one will be why did we put that in SORMAS, which is not obvious from the beginning, because you know SORMAS is an outbreak management system, and AEFI belongs more to vigilance and safety. So what is it? By definition, we call an AEFI, adverse event following immunization, any untoward medical event that follows an immunization. By definition as well, it doesn't necessarily have a causal relationship with the vaccine. A temporal relationship is enough. So it may be any unfavorable sign or a lab finding, a symptom like fever, pain, or even a disease like a Kawasaki disease or palsy, or anything that follows the vaccination. So the question now is, what is the delay between the immunization and the onset of this event? And that will vary according to the kind of event. Like if we are talking about people fainting after the injection, we'll consider only if it's happening a few minutes, maybe an hour, half an hour, or an hour after the immunization. When it's more disease, we'll go for a longer time, usually 1 month, and it will be more long if we are talking about live vaccine as compared to the new vaccine. Live vaccines are the measles or yellow fever, for instance. So this event, I told you, it has not to be at the very beginning related to from a causal relationship. So it can be a true event, adverse event, that is coming from the vaccine or the process, or it can be a coincidence. They are temporarily associated with immunization that would have happened even without the immunization most of the time. we will group that adverse event into different categories, 5 of them. The 2 first of the categories are related to the vaccine itself. So it can be the product within the vaccines or the excipient. This is the first one, vaccine product related reaction, or it could be a quality defect in the product, or eventually potentially with the administration device. You know that we are not only using syringes, and the manufacturer can provide some devices. Then it can be the third category could be related to the program itself, mishandling of the vaccines or wrong vaccine being prescribed, or wrong dose, for instance. It could be a problem with your cold chain, with your transport. And then there's all this anxiety related reaction, which are not unusual. And if not falling within one of these four categories, that will be a coincidence, a coincidental event. Another way to distinguish between AEFI is this classification in minor or serious effect. Minor effects, most of the time, is the immune reaction from the human body system to the vaccine, and the vaccine is meant for that, to trigger an immune reaction. Serious effects are this and only these effects that are resulting in death or disability, congenital or birth defect, or requiring hospitalization. In between, we have the severe effect that refer to the intensity of the effect, not the medical significance of it. So minor effect will be a baby crying for longer than usual. It would be a fever, pain at the injection site, serious effects. We have some of them. Death is like the other severe reaction, are extremely rare. And we really need to pull that up to detect an effect. And actually, it's usually not at a country level, or maybe at a very big country level, that you will be able to detect that. It's at an international level. And for that, we need a database which is currently existing from the drug monitoring side effect. WHO started a few years ago this VGFlow database, where the countries report their adverse event. So this is the process, and this will be very familiar to all of us that are involved in surveillance in general. So it starts in the community. People have been vaccinated, and one of the problems that we have today is the detection, reporting to any system, because the system will the system is passive and will not detect if people are not either in a specific survey, either reporting by themselves. So it means that people must have access to the health system in general. From this point of entry, we go to notification, and that is a first step of validation. Usually, what's happening most of the time is that the primary healthcare provider will notify to a higher level in the hierarchy. And that will vary according to every country policy. and that will trigger an investigation, collecting and gathering data in order to analyze the situation, looking for causality or for ruling out the causality, and then response. Feedback to the system and the community, and reporting. Response, most of the time, if it's linked to the product itself, the investigation will not detect the problem. If it's linked to the program, any problem or issue, like I put the cold chain example here, that you want to address it as quickly as possible. And this is the response. So SORMAS is, and the database within SORMAS is able to have all this information. So following the previous steps described, we will have already basic information about the person. Then the investigation will go and collect more information, especially information that is about the patient prior to the immunization, information about vaccine sites, the facilities, the immunization practices, the logistics behind all that, like the cold chain, the transport. When needed, if you want to assess, to further assess, you'll go back, well, the investigation team will go back to the community, looking for similar events that have happening without vaccination, for instance, if you want to cross-check the situation. We will be able to have in the database other kind of through free text fields, other information when needed, the information status, and the all report production through export or the WHO standard form printing, for instance. So all that is now in this module that Obina will walk you through in a moment. And back to why do we do that? Why do we monitor AEFI in general? It's obvious you're going to tell me. I know that you know vaccination is a public health intervention, and most of the public health interventions are monitored because the public health decision maker doesn't want to harm his population, for instance, so looking for safety, but also for resource allocation, effectiveness, cost efficiency, all that. But I want you to think about that, this following point. In most of the countries where SORMAS is used, health resources like human resources or health facilities are limited. It's the only contact for the community to access any system, health system, of course, but any information system. And this is limited in general. And moreover, when it comes to an outbreak or a stressful new disease, the access to the health facility will be further limited. If you remember the Ebola time in West Africa, people didn't want to go to the hospitals or to the health facility when they had malaria or whatever, because they were afraid to do so. So the access to the health system is limited and could be even more limited. Generally speaking, we have a few health data sources everywhere. And because the entry point is the care provider, your primary health care provider, whose priority is to give care to people. Surveillance is not the priority. So we'll have to deal with people that have other more present things in mind. So what's happening everywhere is that the same set of data is used for different purposes by different bodies or agencies, like vaccination coverage, for instance. This is something we see in different situations. It is used usually to monitor a vaccination program. You have 60% of your kids that are covered by tetanus or polio or whatever. But it is also used by surveillance people to assess health status for a given community or population, and it shows vulnerability. So the information is coming from the same source and will be used by different persons. It's a bit the same here with adverse events. So why monitor? Of course, you want to evaluate the rate of reaction to a vaccine, in particular to a new vaccine. You want to identify events that may indicate a previous known or unexpected vaccine reaction to a new vaccine. And that is why we need to report to an international level to pull up all our data. You want rapid safety signal detection in this context that I described, with an outbreak to manage in the same time population that is more or less reluctant to go and signal anything. Talking about the population, it creates awareness of the safety of your intervention in the community. And beyond that, you will evaluate all these events and make sure that the population knows that it exists, there are coincidences, and that shouldn't be mistaken for a vaccine reaction. So obviously, detection, data collection is linked to databases. So that is SORMAS. I mean, the database, it's obvious for me. The investigation, the pharmacovigilance investigation is really similar to any epidemiological investigation, quite straightforward. And I don't mean easy at all. It's simple. We have algorithms, and it's just following methods or procedures that everybody agreed upon. Something that we can find as well is that the Global Advisory Committee for Vaccine Safety, which is the main body advising WHO for policymaking regarding vaccine safety, mentioned in several reports that this quality assessment is influenced by the quality of the case report, and case report now is the standard. Reporting is case-based. It has moved recently, well, like now 4 years ago, from aggregated data coming from country to WHO to case-based. And this is crucial if we want to have a conclusion about a series of events, to have proper and high quality data. So again, it calls for SORMAS. Another thing to consider is that vaccination is one of the control measures that we are able to put with, and sometimes the most important when we are dealing with clusters, outbreaks. We are dealing with contagious diseases, meningitis, measles, Ebola, Mpox now, and we have vaccination for that. So this is the typical scenario, and we have our health staff whose priority again is to provide care, but has to provide us with surveillance data. We might have a contact tracing team, we might connect the lab, all that through SORMAS, as you know very well. And SORMAS included a vaccination module, and we just added the AEFI module feature to make it comprehensive. So in this scenario where we have to in the same time to use one tool for surveillance of the outbreak and the intervention related adverse events, it makes sense. It avoids duplicating efforts, having your health staff entering data in one system and have to duplicate that in another system, as we have seen in the past. It allows for a decision maker to take a decision and to respond on from high quality data. From the vaccine point of view, the vaccine program point of view, it enhances safety and efficacy, quality insurance regarding the program itself. And then as you let people know that you're doing that, it will improve trust and confidence from the population. So I'm nearly done, and before we go to the practical side, I want to give credit to a number of people and the organization, starting with GIZ. You know, some of the GIZ people are here today, I believe. Want to thank GIZ for funding the program, but not only they provided a lot of support all along. WFP as well co-funded this project. And this project is born a bit more than 1 year ago now. It came on the table from Nigerian CDC and was written by our CEO, Pilar Hernandez. I want to really thank my teammates, Obina and Zohaib, on the IT part. Obina did the module, at least, and Jan, the other SORMAS CEO, who put us on the IT tracks. And special thanks to Chinedu, who's not able to attend due to other duty today, who gave me full support all along. So I want to thank you, everybody there, and so this module is very new. There's room for improvement. We are in the last phase of tuning and testing it internally. We're happy if people want to pilot that in their country. For instance, we will support happily this move. And I will hand over to Obina now for the real stuff. So thank you. Over to you, Obina.
Thank you, Chris. Hi, everyone, and welcome to this webinar. I will walk you through the demo presentation of the AEFI module in SORMAS. This is a SORMAS demo server, and I would want to say that all information here are just for testing purposes. They are not real informations. So I'll quickly log in by clicking login. Okay, so when you log into SORMAS, usually it brings you to the surveillance dashboard. So I'll quickly go to that section. This took me straight to the AEFI dashboard. So on the surveillance dashboard, on the top right corner of this page, you can find option buttons or links to go to the different dashboards that SORMAS has. Okay, this is the surveillance dashboard. You have the contacts dashboard. This is for contact tracing. You have samples dashboard. So what we've done for AEFI is to add another option to this dashboard switcher. Adverse events is on the far end of this option group. So when I click adverse events, it will open the AEFI dashboard for SORMAS. Now this dashboard, it's pretty familiar with other dashboards. At the top of the dashboard, you have a form to filter this data that is displayed on the dashboard. Now, this form has several variables. First of these is period. The period could be, this period element allows you to filter this dashboard by date or by EPI week. So for example, by default, this dashboard shows you data for the current EPI week up to the current day. So, but if I click this button here, SORMAS allows me to filter by today, by yesterday. You can see this EPI week is highlighted. I can switch to last EPI week. I can view information for the whole year up to the current day. I can choose custom. Then you can choose a custom period, either by date or EPI week as well. If I choose date, for example, then I can choose the start and the end date. If I go back by EPI week, then I can choose the starting EPI week as well and the ending EPI week. Then I can apply custom filter. Then to the right, you can also filter, you can choose the date context. Do you want this date you have selected here to filter based on date of report for the AEFI or the date of onset of the AEFI? You can do this as well. Then an additional variable here is jurisdiction. So you can filter further by region, district, or community, depending on what is configured in your locality. As well, you can further drill down by disease. When you're done, you just click apply filter. For example, I could choose, let's say, COVID. And then when I click apply filter, it will filter this dashboard just for COVID. Okay, I'll go down to explain the different sections. If I wanted to reset this filter, or maybe I wanted to choose something for monkeypox, for example, I will select monkeypox, then click apply filter. Then it will filter your dashboard as well. Now to reset the dashboard, you click reset filters. Okay, so just below this filter form, the dashboard shows you numbers of side effects that have been reported. So it shows you, for example, 11 AEFI. That means there are a total of 11 side effects reported. Then it further breaks it down into the reports that are serious or non-serious, which are the side effects that are classified as serious or non-serious. Then to the right, it breaks down the numbers further down to investigations. Out of the serious reported side effects, how many have been investigated? Now to the right of this, you find a breakdown further by investigation status. How many investigations have been completed? How many were discarded? To the end of this section on the right, it further classifies the investigation for you based on the, not really necessarily outcome, but the classification of the reported side effect. For example, was the serious side effect related to vaccine or vaccination? Was it just a coincidental adverse event? Or was it indeterminate or undetermined? Now below this row, this dashboard further breaks down reported side effects or adverse events by the suspect vaccines. So for each primary suspect vaccine, it breaks it down further into how many were reported for this vaccine to be serious or non-serious. As you scroll down the page, you find two visualizations. One breaks down the data by adverse events by vaccine dose. And for each dose, it further breaks it down into serious and non-serious. To the right of this dashboard shows you proportion of reactions or side effects by gender. If I scroll down, then you find the standard EPI curve for adverse events. This is by week, of course. you can decide to group this by day, and then the dashboard will readjust it, or by EPI week, which is the default, or by month if you want to. So I'll go back to the default by EPI week. Then on the right, if you have GIS data tied to the person's locations or vaccination sites, then this map allows you to do analysis based on such GIS information. Okay, so the next step will be, how do you report a side effect? So this module covers both the reporting and the investigation. So what we've done is, on the left of the main menu for SORMAS, just below the immunization menu, you'll find a menu called Adverse Events. If you click on this menu, it will open the Adverse Events directory. Now, this directory shares a tab with the Investigations directory as well. So to the right of this subtab, you can see Adverse Event Investigations. If I click here, it will take me to the directory of the investigations. So I'll go back to the AEFI list now by clicking this button as well. Now, this directory is pretty much like the standard SORMAS directories. At the top, you find a form to filter this directory, either by disease or by the person's details, like the person's name, phone number, email, or by the type of AEFI. For example, I can choose non-serious and click Apply Filter. It will filter this. If I click Reset Filter, it will take it back to how it was. You can also filter by vaccine, which is the primary suspect vaccine. You can further filter by jurisdiction, region, community, and district. So if I chose, for example, a particular region, then I'll be able to drill down further into districts and communities. Then you can further also filter this data by the outcome of the side effect. Okay, if it's for serious AEFI, you can choose the reason for classifying it as serious. Then if you click, let me go back here. There is a button here, Show More Filters. If I click this button, it will show me more filters to be able to filter this data. I can further filter by dates or by EPI week. And then you can choose the reference. Is it by date of report, date of onset, or date of vaccination? Then you can specify the start and the end dates. So this field here is to filter by outcome of the AEFI. Is the person recovering? Did the person die? And all that. So if you click Reset Filter, it will reset this data as well. Now, below this filter form, you find the data grid itself that shows you a list of the reported side effects on SORMAS. So it has several columns. One is the AEFI ID, with a link for you to jump to the details of the AEFI. Immunization ID, which is a shortcut that you can use to jump to the details of the associated immunization record. And then the person ID, which gives you a shortcut as well to jump to details of the person associated with this side effect. Then the standard person's first name, last name, the disease, the person's age, the person's gender, jurisdiction information. Then the reported AEFI, was it serious or not? What was the suspect vaccine for this reported side effect? What is the outcome? Date of vaccination, date of report, date of AEFI onset, and then the list of adverse events related to this report. Then before I leave this directory, on the top right corner of the page, you find a button that allows you to be able to export the data. You can do basic exports, and you can also do detailed exports. So the detailed export is based on the core variables required by WHO for reporting AEFI, but the basic export just gives you basic information. Okay, so if I click on a link for a particular AEFI, for example, this first record, it will open the reporting form, the form that was used to report this side effect. So at the top of the page, you can find shortcuts to go back to the associated immunization record, for example, I could click here. And then if I wanted to jump back to the side effects, to the right of this immunization record, you see a sidebar listing all the side effects reported for this immunization. I can click this button and it will take me back to that AEFI form as well. This form has two sections. The right section shows you summary information about the person, the immunization, and if any investigations have been done. Then you can see the person's identification. The person's name, date of birth has already been collected during the immunization. You can see all the vaccines administered, but you are able to click this button to select which was the primary suspect vaccine. Then you find a section for adverse events, so you can select the relevant information. Then you can enter the date and time AEFI started. You can choose whether the AEFI is serious or not. Then you can select the reason. So I'll go now to quickly fill, this is an existing record. So what I'll do now is to show you how to report a side effect. So I'll go to the immunization directory. So I have already prepared an immunization record for this person, Gilbert Callahan. So this person has immunization for monkeypox, and he had 3 different vaccines for different doses. So to the right section of the immunization data form, we have added a sidebar for adverse events. So if I wanted to record a new one or to report a new side effect, I'll click New Adverse Event. If I click this button, the reporting form then opens. Then I can fill in this information, the date of report, the jurisdiction information is already tied to the immunization record. So I'll quickly fill in this information. Then the variables that are required are highlighted in bold and have a red asterisk to them. So I'll quickly just select all these informations. So on the top, you have the reporting information, the date of report, the reporting user. If you click this button, you can see more information about the reporting user. Then the jurisdiction, the AEFI reporting ID number, whether the user is pregnant or not, whether the user is lactating or the person, sorry, not user. Then you can enter age at onset if you have that information. Just below this, you find the vaccinations that were given to the person during the immunization. But you have to select which of these vaccinations is the primary vaccine that is causing this AEFI. So I'll click Select Suspect Vaccination. If I click this button, then I can choose a particular one. Let's say this. Then I can select the adverse events. So maybe the person had a seizure as well. Then you can choose the type of seizure, febrile or not. Date and time AEFI started, let's say yesterday. Well, is the AEFI serious? Maybe yes. Then this form has dependent variables as well. For example, because I chose yes, then I have to choose reason for classifying this AEFI as serious. So let's say the person died or is life-threatening or the person was hospitalized. What is the outcome? Maybe recovering. Is investigation needed? Maybe yes. Date investigation is planned. I'll choose today's date. All these ones are not required, but you can enter the worldwide ID, date received at national, and all that. Then I'll click this button to save it. So this record has now been saved. If I go back to the person's immunization record, now you can see there's a side effect reported for this immunization. Now, because this is serious and investigation is planned, I will click this button to go back to the AEFI. Then to the right of this form, you can see a sidebar for investigations. So to report an investigation for this side effect, I'll click New Investigation. It will open the investigation form. Both the reporting form and the investigation form are all based on WHO standard reporting forms for AEFI reporting and the investigation. So on this form has several sections: basic details, section for relevant patient information, details of first examination, and all that. But because they have a lot of variables, what we've done is to collapse them, each of these sections. So when you click the heading of a particular section, it will expand it so you can complete the information there. If you click the heading again, it will close it up. But by default, the basic details and findings section and investigation status are expanded by default. So I'll quickly fill in this investigation. List of vaccination. I'll choose government health facility. The immunization, the vaccination, was it done in a campaign or routine immunization? Let's say campaign. Date of investigation, let's say yesterday. Dates of filling this form, I'll choose today. This investigation, is it the first one or the interim or the final? So I'll choose first, for example. The suspect vaccination here is not required because you may not know what it is at the time you're investigating until you are done. The type of site, I'll choose fixed. Date and time of first key symptom, let's say on Saturday. These ones are not required, but you can enter the date of hospitalization and the date it was first reported to the health authority. What's the patient status on the date of investigation? If I chose, for example, recovering, that's fine, but some of these options have dependent variables. For example, if I choose died, then I have to enter the date and time of death. As well, if I choose autopsy done, then I have to enter the date the autopsy was done as well. If I choose no, then I have to enter the date the autopsy is planned to be carried out. So I'll just choose recovering, maybe. Then, assuming I don't have information for all these sections, but let me just show you what they look like. If I click this section, then I can select options for relevant patient information. For example, did the person have past history of similar event? I can say yes. Are there adverse events after previous vaccinations? Maybe no. History of allergy to vaccine, drug or food? No. So you can choose all these options. If the person is an infant, then you can as well choose some other informations. If the birth term, was it full term, preterm, or post-term? What was the delivery procedure, normal, cesarean, assisted, or with complication? You can also enter the person's birth weight if for infants. Then the next section, details, allows you to enter details of the first examination of the serious AEFI case. If I click this button, it can expand. Here is asking for source of information. How did you get information about this serious AEFI case? Was it by examination of the investigator, or from documents, or from verbal autopsy? If I choose verbal autopsy, then I'll be able to also enter other information as well. This is multi-selection. You can enter other sources of information where you got information for this. You can enter signs and symptoms. You can provide information about other sources who provided information of this report. Clinical details officer, you can capture information about the person, the clinical officer who did the examination. If the patient has received medical care, you can select yes, and then enter information about the medical care given. Then here you can enter the provisional or final diagnosis. The next section talks about, allows you to enter details of vaccines provided at the site that was linked to the AEFI. If I click this heading as well, it expands. When was the patient immunized? You can select. If the vaccination was for multiple vials, you can enter when the vaccine was given. Then you have all this information you can provide as well, whether there was error in prescribing the vaccine, was the vaccine administered, was the vaccine administered, could it have been non-sterile? Maybe no. Was the vaccine's physical condition abnormal? Maybe yes. So you can enter all these details as well. There is information to provide if this case was part of a cluster. You can provide more information about it here. Then the next section is about immunization practices at the place where the concerned vaccine was used. If I click this button, it expands. It allows you to enter information about syringes used for the immunization, where AD syringes used, maybe yes. The type of syringes used, maybe disposable. Then you can provide information about reconstitution as well. Then there's information about the injection technique used, whether the correct dose or whether the injection technique was based on the correct dose and route. If you say yes, if the time of reconstitution is mentioned on the vial, you say yes. If non-touch technique was followed, maybe no, and all that. Then there's a section for you to provide information about cold chain and transport. So you can provide information about the storage point for the vaccine, whether the temperature was monitored of the refrigerator. Maybe yes. Were there any deviations in temperature? Maybe no. So were correct procedures followed in storing vaccines, diluents, and syringes? Maybe yes. So you can provide all this information. Then you can also provide information about the vaccine transportation, the type of carrier used, whether short range, long range, or other. Then the next section talks about community investigation, whether any similar events were reported within the same period and in the same locality, maybe yes. And then you can provide additional information of the events or episodes. Then of those people reported, how many were vaccinated, not vaccinated, unknown. Then you can either enter your findings, observations, and comments. Then the investigation status section allows you to choose whether the investigation is completed. So maybe it's done. You can further enter information about the details of the investigation. Then you can now choose how you classify the AEFI or the side effect. Is it related to vaccine or vaccination? Was it just a coincidental adverse event or undetermined? So let's say it's related to vaccine or vaccination. You can further provide more information about the details here. Then you just click Save here. So at this point, when you go back to the dashboard, all the informations now count as part of this dashboard. You can find information about the AEFI and the investigation again by going to Adverse Events. You find the directory. This is the one we just entered for Gilbert Callahan. If you go to Investigations, you can as well see details of the investigation here. Same with adverse events. You can also export the data of investigations by clicking here. All right. So I think that brings me to the end of this demonstration. Thank you, everyone.
Okay, so thank you everyone for watching. We will now move to the Q&A session. This will not be part of the recording. If you have questions on the AEFI module and want to get in touch with us, please do so on our SORMAS community online platform and also via email on our info@sormas.org email address. Thank you very much for watching, and I hope you enjoyed.